So we're continuing to work through the practice management menu. We're getting towards the bottom, and I just wanted to show you some of the different views that the CNC patient chart can generate for you. These are just views. It's just a quick way to look at the whole database all at once based on different search criterion. So for example, on the top, all dispensing. If we go to a view of all dispensing, this will show you every drug that we've dispensed from the clinic. And then you can sort it by various criterion. So you could put in the dispense date. For example, if we put in the dispense date of January 16th, 2013, it will filter by everything that was dispensed on that day. Or if you wanted to check if there was a concern about a specific individual's dispensing, we could filter by that individual. Again, if there was a concern about a specific drug, you wanted to look at all the dispensing of a certain drug. Let's say there was a recall on phentermine 30 milligrams. Then you can quickly pull all the patients that were dispensed phentermine 30, and furthermore, you could do it by a specific dispense date. Or if you're following your batch and you'd put in your batch code, you could pull the whole medication from that batch code and quickly link to those patients' charts and contact them and let them know there was a drug recall. So again, just a really quick way to go through the database and find information on dispensing. All of the other views work very similar to this, so I'll just show you a couple. So if we go to a view of all EKGs, for example, it's going to pull all the EKGs for the practice, and you could filter that. Say that you wanted to monitor patients that had a QTC greater than 440. You could filter down to just those EKGs. And further, you could do a date search for those EKGs. And so on and so forth. So again, these views, I'm tweaking all of them a little bit. I'll be tweaking these search criterion. But it's a really quick way for you to go through, maybe you want to look at all of your EKGs that were done on, January 29th. So that could give you your EKGs for the day and let you double check all of them, for example. You can look at all labs, same type of thing. It gives you a way to quickly sort through a patient's labs. You can look at the date, and then you can search by any of these search criterion, again, just to quickly query your entire lab database. So, for example, you could pull all of your patients with the cholesterol above 250. And it'll show you every lab for each patient that had a cholesterol above 250. The rest of these work very much the same. You can look at all of your RD visits, so you could pull all the RD visits for a certain date or for a certain dietitian. You can go all your doctor visits, all your referring doctors. That's a really neat one. You could go into referring doctors and let's see here, we can look at the referring doctor. Let's say there's a doctor that refers a lot. You could put their name in for referring doctor and quickly generate a report of all that doctor's patients they've referred you, and then maybe you could write them a consult note summarizing, the 5 or 6 patients you're working with that they referred. Or you can go into all weights, so you can look at a database of everybody's weigh-ins, and search by various criterion. For example, let's say you want to pull a list of your patients who have lost more than 50 pounds, and you want to send all of them a congratulation note. You could put that in, and it tells you, all of your patients that had lost more than 50 pounds. Or let's say you want to look for a list of your patients that have failed to lose weight. You could look for patients that had lost less than 10 pounds and see what's going on with those. Were they just started, or what's going on? So you could filter that by date. But if you want a list of your patients with the BMI over 50, we could enter that there. So again, I'm going to tweak all of these search boxes, but that's basically how these views are going to work. And I think that's enough. Hopefully that gives you at least a good idea of how the views work. And check back, because I'm going to update these quite a bit and make the search boxes easier to use.